A lot of protests out there against the president's health care plan. They continue to rage on at town hall meetings across the country. Our next guest recently felt the brunt of some of those protests. New York Congressman Anthony Weiner is a member of the Energy and Commerce Committee. And Congressman, thank you for joining us today.
My pleasure.
When we start talking about some of the outrage in the town hall meetings, what have you seen yourself?
Well, there's a lot of misinformation out there, a lot of people who have been riled up. I think the focus of the attack has been seniors. You know, if you get seniors agitated enough about health care, members of Congress will run for the hills. But frankly, much of the stuff seniors have been told isn't true. And I think seniors also understand something. They have experience with a single-payer national health care plan that's government-run, government-administered that they like. You know, Medicare is this weird dichotomy. Medicare has actually been a pretty successful program. It's got some financial problems, but as far as consumers are concerned, they like it. So Medicare has been used as the boogeyman. We're going to cut your Medicare is what the opponents are saying. And President Obama hasn't done a great job up to now putting their minds at ease, and I think that's been part of the problem.
Well, I mean, you talk about misinformation, but a lot of questions come as to how do you end up paying for all of it without rationing somewhere down the line. You think
health insurance companies are rationing now. They're telling people we're not going to give you coverage, we're not going to pay your bills, we're not going to cover pre-existing condition. Let's keep in mind something. We are paying an enormous amount right now for doing nothing. You know, my constituent in New York City pay about $3 billion a year for the uninsured and the underinsured. So that's $3 billion theoretically less they're going to pay. We're paying more in products than we should because so much of health care is built in. So it's not a matter of whether we pay more or less. It's frankly we've got to pay less somehow because health care inflation is going up so high. It's whether we pay it more efficiently into a sound system that covers everybody.
And yet this idea of a single-payer plan that the government would run, headlines across the country today are talking about how the administration is stepping away from that idea for the first time.
Yeah, that's not a single-payer plan. Single-payer plan is what I propose, which is Medicare for all Americans. You know, the real question is not, in my view, should there be a public plan, is I'm not quite sure what private insurance companies are bringing to the table right now. About $200-some-odd billion every year going to profit and overhead that should be going into health care. But the president does seem like he's moving away from the public plan, and if he does, he's not going to pass a bill. Because there are just too many people in Washington who believe that the public plan was the only way that you effectively bring some downward pressure on prices. And if he says, well, we're not going to have that, then I'm not really quite sure what we're doing here.
So you would not vote for a bill that made it through if it
I don't, not only I, but I think there's probably about 100 members of the House who believe for various reasons that you need to have something to bring down prices. Otherwise, you're basically what you're doing is you're keeping the cost arc. The CBO agrees with that. You know, I mean, I think as it was, the public plan had been watered down so much. So if the president thinks he's cutting a deal to get Senate votes, he's probably losing House votes.
So you think he will lose the liberal wing of his own party, and you don't think he can make that up by attracting Republicans, blue dogs, anyone on the other side of the aisle?
I don't see. First of all, the Republicans have made it pretty clear it's their mission to not have anything happen. I'd be surprised.
Well, some would argue that they want to see something happen, just not a public plan.
Well, they just haven't offered anything. Maybe they're holding it in abeyance. But so far, you know, when it comes to stimulus, they all, you know, by and large voted no. By and large, their entity has been to vote no on things. I'd be surprised if the Republican playbook is to try to give President Obama a win on health care. I think more than likely they're going to vote no on anything. But more importantly, the president's, one of his imperatives, one of all of our imperatives, is to reduce the overall cost of health care to our economy. If you don't have a public plan, you don't have a single plan, a payer plan like I like, you basically have what you have today, just with more people covered. And I don't know how that brings down.
You don't think the co-ops work? The co-op, the idea.
I don't think they would. I mean, the problem is that you need prices tethered by someone. You know, a public plan that's tethered to Medicare in some way, Medicare plus 3 or 4%, 5%, forces the private insurance plans to compete. Now, if you have a co-op plan that isn't really tethered to anything in particular, all you're really going to have you know, is a group of people who's going to have to recruit doctors to come in, and they're going to do it by offering higher reimbursement rates. So I don't know how exactly it's all going to work out.
Congressman, is it realistic to try to handicap health care costs? When LBJ introduced Medicare in 1966, the estimate for the 1990 cost of Medicare was $8.8 billion, and it wound up being $98 billion. And that's basically because innovation took off, and it's very difficult to handicap what the cost of health care will be. Can you understand how a lot of people are, I guess, skeptical about what health care will cost in the future, and how even despite the best efforts to rein this in, it's going to be very difficult for anyone that's making a plan now to know what's going to happen in the next 5 or 10 years.
Well, I don't know. I mean, perhaps, but I can tell you, Walmart is doing it with prescription drugs. They're using a very large buying pool, their marketplace, to say, I'm going to charge $4 for prescription drugs when everyone else is charging $15 or $20. We, the federal government, have the ability to do the same thing. We've concocted a very inefficient structure to do this. We took what is essentially a non-commodity and started to price it like a commodity. Healthcare is not. Someone says you need a gallbladder, you're not going to shop right now, I'll get a liver instead, or I'll wait till next year when it goes down in price, or I'll choose a different color gallbladder. And the problem is that when you try to take a non-commodity and try to treat it like it is, you have no control of cost because people will pay anything to get that gallbladder. That's why government ultimately has to be the one to hold down costs.
If there's no public plan and you think that will basically kill any policy, what's wrong with attacking this incrementally? Doing tort reform this year and then trying to do something else in the next 2 or 3 years?
Well, I mean, tort reform is a bad example of that. We've got tort reform in several states.
Electronic records, something like that.
You can do these type of things, but most people agree that the problem is that so long as you have 40 to 50 million Americans who have no insurance, and we are paying for that cost in a terribly inefficient way when they walk into hospital emergency rooms, you're not really going to solve this problem. I think you have another problem. You have this weird structure that we're paying for health care by incentivizing people to do more things. A doctor has a checklist of things he can do, a test, a stitch, or whatever. He gets paid that way rather than by outcomes. We have jerry-rigged a system unlike any other anywhere else in the world, and it's given us extraordinarily high-quality health care for some and basically mediocre for others and none for another group. I don't think this is going to work.
All right, Congressman, we want to thank you very much for your time.
Thank you.
We hope to check in with you again very soon.
It'll be my pleasure.
Okay. Coming up